Well, when seconds count, Flight for Life gets to work saving lives. CommonSpirit Health sponsors Healthy Colorado Conversation. And with us is Chief Flight Nurse Teresa Elder. And oh my goodness, Teresa, I have so many questions for you. First of all, thank you for being here.
Well, thank you for having me.
Yes, you have such an important job. So for you to take time means a lot to us. So first of all, what kind of special training do you need to be a Flight for Life nurse? This has got to be kind of grueling, right?
Well, actually, for our nurses that are we hire, we do require that they have 5 years experience as a critical care nurse. So they've taken care of the sick patients at the hospitals. After that, all the training for the position comes once we hire people. So I am in charge of our orientation and training. So we put them through a pretty rigorous orientation period, get them trained up for all the things they need to be able to do.
Absolutely, and I can imagine, especially when you're trying to, hone in on those skills and then being up in the air on a helicopter too. It's got to be, so much is happening, which is amazing. We're so grateful to the work that you guys do. So how many flights would you guys say that you do within a month or so?
Well, it is variable by season sometimes, summer being our busiest season, obviously wintertime too. But for helicopter flights, we average about 150 flights a month.
Wow.
People don't realize we also have airplanes that we fly in and transport patients, and we also have mobile ICU ambulance or critical care transport ambulances. Wow. So when you add all of those together, we do about 350 transports a month.
My goodness.
So we stay pretty busy.
Absolutely. Well, and I can imagine too, okay, so we're here in Colorado, we have the mountains, there are so many variables that we have to worry about, right? So where do you think the riskiest place is to fly or to land for you guys, or even to drive in? I can imagine the mountains can pose some tricky situations.
Yeah, we do have an ambulance that's based up in Summit County, so yes, the I-70 traffic and roads affect us too, but I really probably would say that the most challenging places for our pilots to land is when we are in the backcountry, landing at 13,000 feet. It's always windy up there on the ridges of those tallest mountains, and landing up there on our search and rescue flights to help rescue people that are in the backcountry is probably the most challenging as far as places to land and maneuver the aircraft.
I bet.
We fly aircraft that are specifically built for high altitude operations, so and all of our pilots have many hundreds of hours of mountain flying experience.
Amazing. Okay, so very well trained, very well versed on all ends of the spectrum, which is so great. Let's talk about what kinds of treatments you guys perform in flight. What is the helicopter equipped for? I mean, I'm sure there's a lot that you guys have to kind of dig into in flight, right?
Well, the whole concept of Flight for Life was to be able to bring critical care medicine right to the patient versus waiting for them to get to the hospital. So even though we fly in a very small helicopter, we are fully equipped with much of the same stuff they'd have in the emergency room. We carry whole blood with us all the time. We have ventilators, cardiac life-sustaining equipment, all the different medications, IV pumps, everything it's basically a little flying emergency room or ICU room so that we can get done what we need to get done in a very small and cozy space.
Yes. Oh my gosh. So you guys are ready for it all, which is so great. Now, I have to ask you just out of curiosity, because I'm a skier. I love hiking. I love doing the backcountry stuff that I'm sure you're like, don't do that. But what do you tell people, especially when they're heading up to the mountains or maybe going skiing or hiking or trying to kind of traverse in places they shouldn't? Anything that you recommend or you tell people when it comes to safety, just to make sure that maybe you don't have to get called out there?
Yeah, you don't want to ever have to go with us. I would probably say for all of our skiers and boarders, wearing a helmet, that really is a necessity, no matter if you're an expert or a beginner. If you're going into the backcountry hiking, don't ever go by yourself, and always let people know when you are going to be back and where you are going so that we can find you. And then secondly, making sure that you have communication devices with you, your cell phones. Our cell phone coverage is getting a lot better. Some people carry the devices that can automatically send out an SOS type signal, so that's very helpful. It helps us find people. And then as far as just backcountry recreating, making sure you are trained in what you're doing. We go on a lot of ATV accidents. I feel like people can just rent an ATV and then go in the backcountry on trails, and they're not, or snowmobiles, and they're not trained in how to really operate them, or skilled maybe more so than trained. So I think those are my probably biggest safety tips I would give to people.
I think that that's huge. And again, this is one of those things that, for all of us living in Colorado, we are excited to get back there and out there.
That's why we live here.
Yes, exactly. But we are so grateful regardless to be able to have people like you, just in case. We hope that we don't have to call you, but if we do, I hope that you're the one who ends up being on the flight. So Teresa, thank you so much, of course, and thank you for everything you guys do.
Well, thank you for having us.
Of course. And guys, human kindness is what CommonSpirit Health is all about. So visit their website and research doctors and medical teams that can help you. You can go to mountain.commonspirit.org. Healthy Colorado segment is sponsored by CommonSpirit Health.